All right, I'm back.
Okay.
You might see the video feed start here in just a second.
Okay. Yeah, there's a commercial going right now.
5 minutes until
Yeah, we
showtime.
started it early because it runs that commercial at the very beginning. The commercial's running, she said, on the website, so we're okay. I think we got about 5 minutes till we air.
Okay, I can see the two microphones. I
Yeah,
cannot see you at all.
I'm right in front of one of the microphones. You don't see me?
Well, it's no, I don't see you at
I'm,
all. Your hand is up, it looks like, but it's like a
all right. Apparently, I'm cut off of the.
still picture.
Let me know. We're adjusting the camera. How
Okay.
about now?
Well, it's like a still shot for some reason. Let me hit the.
Four
I can
minutes
see.
until showtime.
I can see the front of your face in the front, but you can't see like the back of your head
All right.
or your back. So I can just see the front. Yeah.
How about now? Is that
That's a
better?
little bit better, but then you're cut. No, you're cutting off the other
Now,
person
now she can't see
unless
the
you
guest.
move their chair over towards the banner.
Um,
Mm-mm.
on the Ustream panel, click Advanced, and then there should be a checkbox over on the right-hand side for widescreen. Do you see it? Do you still see the Ustream broadcast?
Yeah, I do.
Okay.
But what you could do if you move that chair over.
Three
because what I
minutes
see
We-
back
until
of the chair-
showtime.
We have no room to move any of the chairs. I mean, we're going to be lucky to get everybody in
Move
this.
the chair move. You can't move the chair towards the banner.
No, I'm up against the wall right now, and we've got a restriction on the cords and everything. So
Okay.
we're as positioned as we can get. Oh, really?
Okay.
All right. On Charlotte's computer, she's looking at the Medicaid Talk. She can see me fine. So it might be the resolution on your computer that's cutting it off.
Okay. I made it larger, and it does look. You do look a little bit better. I just wish we couldn't see those people that were walking behind.
Yeah,
but
there's no
I
way
guess
around
you
it.
can't
I know. I wish
see
we could
right.
too. Believe me, we are shoved in a
Okay.
corner.
I
You know,
know.
in the best position we could to be outside of the thing.
2 minutes until showtime.
Got 2 minutes.
So do you have a guest that's going to be here in 2 minutes?
Probably not for 10 minutes, but we have about 8 people that's going to be coming on, similar to the last one. All right, that's all right. He's not supposed to be here till 1:40 anyway. Okay.
1 minute until showtime.
Linda, go ahead and put yourself on mute because Charlotte had to step away to find our first guest.
Okay.
We got about 20 seconds till we go live, but it'll be about 6 or 7 minutes before I get to your part.
Your show will go live in 5 seconds. 4, 3, 2, 1.
All right.
Blog Talk Radio.
Welcome to Medicaid Matters, the only live talk show about the business of Medicaid health care. And now, here's the host of Medicaid Matters, Richard Yaden.
And thank you, Braley, and welcome. Today is Monday, November 7th, and we are live here for a very special 2-hour edition of Medicaid Matters. I'm Richard Yaden, President of Managed Medicaid Services, and your host for the next 2 hours. As I mentioned, we are live at the Medicaid Health Plans of America annual meeting here at the Hyatt Regency on Capitol Hill in our nation's capital. And today we have an all-star guest lineup for you, which is what we want to do at Medicaid Matters. We want to make sure we have the best guests to talk about the hot topics in Medicaid health care. And for the next 2 days, this is the premier gathering of our country's managed Medicaid leadership. Already this morning, we've heard from Karen Clark, who is president of Horizon New Jersey Health. We've heard from Michael Rashid, president and CEO of AmeriHealth Mercy, and political analyst Donna Brazel. And if you're part of any managed Medicaid organization, this is the place that you need to be. And fortunately, Managed Medicaid Health Plans of America has invited us here, and we are going to bring you as much of this conference in the next 2 hours that we possibly can. In just a couple of minutes, President and CEO of Medicaid Health Plans of America is going to be joining us. But just take a minute and listen to the lists of guests who are going to be on our show over the course of the next 2 hours. We're going to have Jill Spencer of Human Arc Corporation, Kevin Hayden of WellPoint, Cindy Helling, who is Executive Director of Select Health of South Carolina, Michael Gardner, President of the Florida Association of Health Plans, Dan Rizzo, Chief Innovative Officer at MedAssurant, Frank Sayo, who is the VP of Business Development at Coventry Healthcare, Dan Hennigan, VP of Marketing and Sales for RxEOB, and also Karen Clark, President of Horizon New Jersey Health. All are part of our lineup today for you to be a part of this conference. So we've got a lot of ground that we're going to cover in the next couple of hours, and we're going to be jumping into this in just a couple of minutes. Also, if you are on our show's webpage, www.medicaidtalk.com, you can also watch our show live through our video feed, which is being broadcast over Ustream TV. We're live and we are interactive for the next 2 hours. Our regular listeners know that being interactive is a big part of our program. You know that you can call, you can tweet, you can chat questions or comments about the show's topic live during our broadcast. If you're a new listener, you can call us at 626-657-2125. That's 626-657-2125. And that really is the best and the easiest and most effective way to give us your input about our show today or any other topic. If you're logged into your Twitter account, you can send us your comment or question to Medicaid Talk. Today we do not have the chat line open, so you're not going to be able to get a hold of us there, but we've got a lot of different ways for you to be a part of it. And since this is since we're at this Medicaid conference, we're also asking a question today that we're hoping you'll respond to. And the question is, what is the main reason you attend a business conference? There's a lot of different perspectives about how that works and how that could be put together, and we'd really like to hear your thoughts on what do you look for in a business conference, and I can guarantee this conference will accomplish all of those objectives. So please call, chat, or tweet your answer. We'd like to share it here online, on the radio, on the air during the next 2 hours. Also, while you're at the Medicaid Matters homepage, don't forget to vote in our poll. It's up there every month, a different poll, and you'll want to be a part of that. Well, if you're watching on Ustream, you see that we've been joined by Thomas Johnson, President and CEO of Medicaid Health Plans of America. Thomas has been a guest on the show before in the past. Is actually one of our most listened to and downloaded programs we've ever had on the show. And we're very, very fortunate to have him here. I know he's very busy working through this conference, but we're very, very fortunate to have him. So, Thomas, welcome.
Thank you, Richie.
Glad to have you here. Well, why don't you give us a very brief background of this annual meeting? I know this has been going on for a while, but how did this get started and maybe how it's grown some over the years?
Well, I think we were looking at what other associations are doing. I come from an association background primarily. And when I came to MHPA, I wanted to have it, replicate what the association business was about.
Yeah.
And part of that is bringing together, people who are in the same business, get some interaction going, educate them, talk about issues. And in 2005, we had the first one of these up at the Mohegan Sun in Connecticut. There was actually a nor'easter that took place during the first day.
It always happens like that.
Exactly. And so a number of our speakers actually just flew for the day and then flew back. And so I'm just glad that there weren't any casualties that took place
that's true.
during that first conference. But, that's just one of the things that I wanted to try and bring to the association, that we have certain components so that people have something to come together to once a year and to bring the industry together. And so this is our 7th one. We're about 9 times as big as we were when we had our first one. And every year we seem to have more people than we anticipate, but that's a good problem to have.
It is. Our people watching can't see all the bustling that's going on around here, but this is, there's a lot going on today, and it is certainly the biggest one I've been attended since I've started coming to these. Anything new at this year's meeting that you're doing?
Well, for the most part, we're doing similar things. We actually had a pre-conference this year, yesterday, focusing on a number of compliance issues. That was sponsored by Epstein, Becker and Green. We had the former New York Inspector General Jim Sheehan give some remarks, as well as a couple of very good panels. So that was something that was new for us.
Sure.
We have the Capitol Steps. They're going to be performing later on today.
Looking forward to that.
Reception. So that'll be something new in terms of entertainment. This being Washington, I think the audience is ready for them. So we add a little bit every year. We want to try and keep it manageable, but at the same time, I think the attendees expect us to do a little bit more every year, and so gradually we try and build on to the conference. I imagine next year we'll probably add a clinically related post-conference. That's what we're looking at. The conference will be at this location again next year, so we'll probably look to add that to next year's meeting.
Right, and this is a marvelous location. Gorgeous hotel. Facilities are first class. If people didn't get here, they're really missing something. I hope they plan to do it next year and be a part of it. There's a lot of talk, going on in this conference because we have a lot of different representation from different organizations here. But if you could maybe summarize, what's kind of the general buzz that's going on today that people seem to have the most on their minds?
I think working with increased regulation and scrutiny, knowing that the resources that they may need to work under that may or may not be there. Because we're being asked to do more. We're being regulated a lot more. At the same time, states and the federal government are looking to spend less, or at least limit the amount of money they're spending. So it's a challenging environment. I think the thing that gives the industry some, not concern necessarily, but some pause, is that those two things aren't, reconciled. And, we're looking at a potential expansion in a way the Medicaid program's never seen. We're looking at probably most of our plans participating in the health insurance exchanges. But they've got to be sure, because they are businesses, whether they're for-profit or nonprofit, that they're going to be able to take, reasonable, acceptable risk with these new populations. So, the dichotomy between the two is extremely challenging for the industry. We are looking at, regulations regularly that are hundreds, of pages long.
Yeah.
And I know we've had to change things within our organization just to make sure we educate our members as to what's included in them. So it's it's difficult. I mean, it's busy, and then we don't mind being busy,
right.
But it's a very challenging environment.
November 23rd is a big date. There's going to be a lot going on in Washington on November 23rd, and for those of you who don't recognize the date, that's the date the Super Committee is going to give its recommendations. And I know we don't have a crystal ball here, but you're someone, and your organization is an organization that really stays on top of what's going on behind the scenes in Washington. Do you think, and I'm not going to put you on the spot and ask for numbers or anything, but do you think Medicaid expansion that we've been talking about for a year and a half, ever since healthcare reform was passed, do you think it's going to still be on track for a large expansion coming out of the Super Committee?
My sense is that, just from everything that I've heard, I don't think the Super Committee is going to look at curtailing the expansion per se.
Okay.
Now, obviously, they're meeting in private, and you never really know until you see what comes out. But just from everything that I've heard, I don't see them necessarily derailing that. I think there's a chance that they may look at some of the subsidies in the exchange. I think there's some chance of that. But I think the general consensus within the healthcare lobby is that they're probably not going to touch the expansion. So, that's what we feel like, at least going into November 23rd.
Okay. Well, and it's, you're absolutely right. It's hard to tell. You see conflicting reports all the time in the paper about who said what and what's going on. So it's going to be very interesting. I for one, will be very impressed if they can come to any kind of consensus.
That's actually, I will tell you, we actually had a number of speakers this morning that indicated that, the betting line seems to be that the Super Committee is going to fail.
Yeah.
Which, overall I think would certainly be a shame. It would kind of say something about the state that we're in Washington.
Yeah.
If there's a failure to agreement. But I think most observers feel like they're not going to be able to come into agreement.
Yeah, it is a shame.
Yeah.
It really is. Well, is there anything, kind of getting back to the conference here, anything next year, and we talked about the post-conference, anything next year that's going to be new and different than not here this year?
Well, we haven't booked our speakers yet. I will tell you this. Every election year we've had a Charlie Cook type speaker who's spoken at our conference in 2010 and 2008. Wouldn't be surprised if you see him again in 2012. I just had a chance to see him out in California. Really made some interesting analysis about the Republican presidential candidates. So I wouldn't be surprised if you see Charlie Cook as part of our agenda next year.
I remember a couple years ago, Sam Donaldson was a speaker. That was that was right before election too. It was very good.
It's right before the presidential election. And it was interesting. I think Sam Donaldson spoke in the morning. Charlie Cook spoke in the afternoon. I think our conference was maybe a week and a half before the actual election, and they both said that the race was over.
Yeah.
You know, and it was just interesting that they were both just on message.
Yeah, it really was.
Yeah.
What are some, maybe give a quick rundown of some of the speakers that are yet to speak today and tomorrow? I know you've got a real all-star speaker coming in tomorrow.
Sure,
to talk.
absolutely. We've got Donna Shalala,
right,
former HHS secretary. Just from the booking agency we use, the reviews have been outstanding. So we're really looking forward to that. John Gorman, CEO of the Gorman Health Group, will be our second luncheon speaker tomorrow. He's a favorite with our conference and usually speaks almost every year at our conferences. And like I said, the Capitol steps will be very interesting. I think that'll set off this evening very well.
Typical convention atmosphere.
That's right.
Well, great. Well, I appreciate you taking a few minutes to sit with us and talk about the conference. It is one of the best conferences I know in our industry that I've attended and been a part of. And I would say if anybody is involved in the Medicaid industry or at least the Medicaid managed care industry, they need to be here because this is the epicenter of Medicaid managed care these 2 days.
Well, Richard, I appreciate that.
Good.
Thank you.
Thanks for joining us.
Okay. Thanks.
All right. Good
Bye-bye.
seeing you. Folks, that's Thomas Johnson, President and CEO of Medicaid Health Plans of America. It is his charge to put together this great conference, and he does a fantastic job. Their whole organization does. So we're very happy to be a part of it. Very glad that they invited us to be a part of the conference. The conference runs throughout this afternoon, and will also be running tomorrow. And for at least half the day, I did have a chance to sit in on a few of the pre-conference events. They were outstanding. The quality of speakers, which we have one that just joined us, is always first class at this conference. So you want to make sure you add this to your repertoire, add this to your list of conferences that you're going to attend. Well, if you're watching on our Ustream broadcast, you see that Jill Spencer, VP of Business Development for Human Art Corporation, has just joined us. Jill is here. She is moderating one of the presentations, coordinating between Medicaid and new health insurance exchanges, a topic on everybody's mind. Jill, welcome to Medicaid Matters.
Thank you.
Glad to have you here.
Appreciate it.
Maybe you could spend a minute and touch on some of the main points of the session that you're moderating today.
Sure. I think the focus of the session really is to review some results of a survey that Sellers Dorsey had done that looks at some of the things that the states are going to be doing and considering to be different for with healthcare reform. So, enrolling new populations, funding, and probably most importantly, what happens with the exchanges.
Did the presentations touch on any of the potential recommendations coming out of the super committee by any chance?
No, they don't.
Okay.
I've stayed away from politics a bit. It's really just more of a from the state's perspective.
Okay.
What are the things they're challenged with and what they're going to have to face.
Okay. That's information that, the exchanges are just starting to come online. It's information that I'm sure everybody is interested in seeing, and how's this really going to work out. We kind of understand the theory of it and everything. What do you hope organizations do with the information that was in that session and presented?
I'm not sure that there's anything yet to do other than there's got to be some awareness. I think one of the challenges that many Medicaid plans face today is that often the only constituency they serve are the Medicaid enrollees. And with the exchange, you're going to be required to serve many more people. So it's that kind of one door in gives you access to all of the coverage that you need or that you might be eligible for. And so the challenge, I think, for Medicaid plans today will be how they can become more to more people and provide a broader scope of coverage options. Otherwise, you face what's going to be churn. In other words, people's eligibility changes, they fall in and out of the exchange, and so there's this idea of broad spectrum of coverage, and how can Medicaid plans offer that?
What were some of the ideas that were offered in
well,
that
we
vein?
haven't had the session yet.
Oh, I'm sorry.
That's okay. That's okay. And I'm not sure that there are specifically any recommendations coming out of ours today, although it would be interesting to engage some of the plans to see what they're looking at, because currently that's a big strategy for 2013-14.
Sure. Well, no question. I think exchanges are going to be on the minds of everybody. It's not so much a new idea or concept, but the impetus to implement it is very new. Is Human Art going to be involved in that in any way?
It's interesting you asked that question. We're actually looking into it. My company works with a lot of services focused around eligibility enrollment, and so our key focus is really in the Medicaid space, helping people apply for governmental programs that provide them benefits. We actually just had a meeting. We're based in Cleveland, Ohio. We just actually had a meeting with the Ohio Department of Insurance to start to talk to them about how our core competencies in eligibility enrollment might benefit the state as they look at exchanges. So clearly we're starting to explore that.
Sure. In Ohio, what does the size of the exchanges look like, do you think?
I don't know the answer to that. And interestingly, Ohio is one of those states that they're still exploring the potential. They haven't jumped into the water yet and said, yes, we're going to do an exchange. They've had hired I think, Milliman to do some research for them. So they're really looking at it at this point to say, what if?
Yeah, sure,
So
sure.
no definitive decisions yet.
Tell us a little bit more about Human Arc and its involvement with the Medicaid industry.
Sure. The company's been around for 27 years, and our sole experience is in helping people to apply for governmental programs. We typically go to help people through contracts with hospitals and health plans, finding people who are eligible but not enrolled in programs like Medicaid or SSI disability or SSD disability programs. And then we actually act as the authorized representative for those individuals so that we then help them through the rather complicated application process.
Oh, it is.
And once we get them approved, then that creates a benefit for them. They get either medical coverage or some income that they didn't have before. And on the other side, our clients, who are our contracted clients, hospitals and health plans, also see revenue opportunities as well.
Sure. Well, that makes you well suited to be involved with the exchanges, at least on the enrollment side.
We think so, yep. We hope so.
A no-brainer, right? Well, there are so many different Medicaid conferences that people can go to now. Is there anything particular about this conference that you enjoy or made you pick to be a part of it?
We've actually been attending this conference for the last 5 years. The first 2 just as attendees and the last 3 as supporting members of MHPA. And we chose to be a supporting member because we see MHPA as a real advocate for the Medicaid plans. And so this is not only an opportunity for us to come and see our customers, see our clients, see potential new customers, but also to really keep up on what's happening with the industry. And the caliber of speakers that they have at this conference is really excellent.
Yeah, I mean, it's a who's who of the Medicaid industry.
And getting better every year.
Yeah,
really.
No question. Does now Human Arc, they're not a Medicaid plan, just to clarify for our listeners, they're not a Medicaid plan. You work with Medicaid plans and with hospitals to help Medicaid members get enrolled and do those types of things. Good. Well, is there anything, any particular presentations here at the conference that you're looking forward to, other than, of course, your own? I mean, that you'll be a part of.
I wouldn't say that. Actually, I enjoyed Donna Brazil this morning. I thought her humor was great, but some great points. I've heard Vern speak before. Certainly looking forward to Donna Shalala.
Oh yes.
And John Gorman, I've heard several times, and always gives a good presentation. So nice. I think there's a nice breadth of different types of speakers. So it's very engaging.
A lot of vendors here too.
A lot of vendors here.
Yeah, it's growing every year as well. So I guess that's a testament to the size of the Medicaid managed care industry and how important it is.
Clearly, this morning, Kieran Clark from Horizon NJ Health said Medicaid is hot.
Yes.
And that's exactly, it's true. So you start to see that in not only the attendance here, but even some of the vendors, the increase in vendors that are exhibiting here, simply because there are more opportunities to work with plans and help people. Right.
And that's what we try to do on this show is, as you know, is we try to get those ideas out. We try to help people see that there's a lot of innovation going on in Medicaid right now. There's a lot of chaos in Medicaid right now that is driving a lot of this innovation. And you know, I think it's interesting that we're here in Washington. It seems like there's still kind of the sense that another shoe needs to drop before everybody really knows what we're going to do with all this going forward. Do you find that in the Ohio marketplace as well?
Absolutely. You know, just as I said, you know, Ohio's still looking at whether they'll participate and offer an exchange, or whether they'll let the federal government do that for them. So clearly a lot of outstanding discussions and decisions.
Right. Well, and Ohio is important as a bellwether state from that standpoint, not just in elections, but from that standpoint as well, because so much going on there. What would you say, as you have talked to people here at the conference, what's kind of the general buzz of the mood of people? Not so much the mood, but what seems to be the topic that's on everybody's mind here?
Expansion, I think growth. People are looking forward to the opportunities. I think one of the speakers, and I can't remember which one, I apologize, commented today about if you look at the spending in Medicaid today, clearly the managed care plans have done an outstanding job in managing expenditures and managing care. And so I think the expansion of that is a big opportunity that everybody's excited about.
Good. Well, I appreciate you taking some time to sit here with us and talk to us on the show.
Absolutely.
Maybe we can have you back sometime and we can do a whole show about what's going on at Human Arc and
Okay.
the work that you're doing.
That'd be great.
It's a part, there are a lot of different moving pieces of Medicaid, and I think people are surprised that there's so much going on, and it's good to have people like you on the show so they can hear about the different pieces.
Thank you. I appreciate the time.
Jill, thank you very much.
Thank you.
We enjoy it. That's Jill Spencer. She's VP of Business Development at Human Arc Corporation, and she was moderating the session, or will be moderating the session later today, coordinating between Medicaid and the new health insurance exchanges. If you have a question or anything about that, or a comment about health exchanges, we'd really like to hear from you, especially if you're involved in that in your state. There's a lot of talk going on about health insurance exchanges, as you know, a lot of things in the paper, a lot of things in the news, and it'd be very interesting to hear some of your perspectives as we have these guests here. A lot of what goes on at the conference here is not just presenting the same things over and over. There's a lot of innovation that is being presented here, a lot of ideas. But even as big as the conference is this year, even as wide of a range of topics that we have, there's still a lot of other ideas out here that won't be represented, a lot of ideas that maybe you have, and we'd really like to hear those. You don't have to necessarily engage one of our guests to present those. You don't necessarily have to have a prepared presentation, but we'd like to hear from you. If you want to call and give us your thoughts on some of the topics that we're covering here, whether it's right in line with what's going on or not, we would really appreciate hearing from you. We're also asking the question, what is the main reason you attend a business conference and being a part of the conference? It's interesting. Everybody has different reasons for being involved in different conferences. Everybody has a different idea of what they want to get out of it. So we'd like to get your input as well. And you can call us at 626-657-2125, and we really hope that we get to hear from you today. You can also tweet those comments to Medicaid Talk. And again, remember, we do not have the chat line up and operating today just because of our location and all the things that we have going on. We wouldn't be able to get to that. I want to remind you again that we do have a poll on the website every month, and at the end of each month, we talk about that poll and the results of them. Last month, our poll was the question, how do we better control dual eligible expenses? Now, I was at a conference, I guess it was back at the end of September, and dual eligible expenses, it was a conference for CFOs, dual eligible expenses and controlling those expenses was probably one of the main topics on the agenda of that conference, and that was really the buzz. So I thought it was a very good question. So we had several options that you could choose from in the poll. One of them was rethink care coordination. Another option was patient-centered medical homes. Another option, accountable care organizations. New department in CMS to coordinate reimbursements. And the last option on the poll was move all dual eligibles into managed care. Well, guess which one was the most selected option to control dual eligible expenses? It was the very last one, which was move all dual eligibles into managed care. 56% of you responded that was the way to go in order to control those expenses. 33% said we need to rethink care coordination, and 11% recommended patient-centered medical homes. So that's the results of our October poll. We have a new one on the site. We want you to be a part of that and make sure that you get to talk about what's on your mind with respect to that poll. And you can do that at www.medicaidtalk.com. That's www.medicaidtalk.com. We're going to go to our break here in just a minute. We're going to have, coming out of the break, we're going to have Kevin Hayden, who's president of state-sponsored business at WellPoint, is going to be our next guest on Medicaid Matters. So we're going to be going into that break in just a second. We want you to stick around. We have another hour and a half to go following our break, and we will be back shortly after that. This is a great time for you to get on the phone, a great time for you to be a part of the conference. You can participate because we are an interactive forum by calling our number, 626-657-2125. I know You can have a question, have a comment about any of the topics that we're talking about today. It would be very good for you to call in. You can also tweet those questions or comments to Medicaid Talk and go from there. Well, we're coming up on our first break, and then we'll be back to hear more from our all-star list of guests. If you ever wanted to ask a question to the leaders of Medicaid Managed Care, now's the time. Let us hear from you. 626-657-2125. That's 626-657-2125, and we'll be back in just a couple of minutes.
Nurses who want to stay on top of their skills know that the Nursing Informatics Learning Center is the place to go. You'll find articles, tutorials, a blog, e-zine, board-approved CE credits, links, assessments, and consultant services, all available to the global nursing community in one place. If you're a nurse or if your organization employs nurses, you need to visit the Nursing Informatics Learning Center. Go to www.medicaid-matters.com and click on Sponsor.
Medicaid Health Plans of America, ensuring access to better health care. Learn more about the innovative work by Medicaid Health Plans at MHPA.org. That's MHPA.org.
Are you a Medicaid industry expert, state executive, or thought leader? Can you share a perspective about the business of Medicaid that's unique, innovative, or even controversial? If so, you could be a future guest on Medicaid Matters. We are currently scheduling guests, and it's time to share your big idea about Medicaid. Go to our website and send us a message. Tell us what you want to talk about and how we can contact you. Make your voice heard. Make Medicaid better.
Elevating the quality of care with less cost. Today, that's the job of every Medicaid managed care company, but it can't be business as usual. Companies have to coordinate care a different way. The solution is managed Medicaid services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new Advanced Care Transitions program, companies can dramatically raise the quality of care without increasing their cost. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
And welcome back to Medicaid Matters, the only live talk show about the business of Medicaid health care. We're here every other Tuesday talking about the business of Medicaid health care. And today we have a special 2-hour live show from the Medicaid Health Plans of America's annual meeting. We're talking to presenters and attendees, and we're covering just about every single topic under the sun. The only thing we need now is your questions, your comments, and you can share those with us in a couple of ways. Really, the easiest way is to just call in at 626-657-2125. You can also tweet us at Medicaid Talk. That's at Medicaid Talk. And for our regular listeners, you know that normally we have a chat line up during the show. We don't have that going on today, so you're not going to be able to get us at that point. Well, sitting across from me is one of our very special guests to be with us today, Kevin Hayden. Kevin is president of state-sponsored business at WellPoint. He's also vice chair of the Medicaid Health Plans of America. Kevin, welcome to the show.
Thank you.
Glad to have you here. Well, you're introducing a keynote address today that is a topic that is on everybody's minds, trends in Medicaid policy. What are you doing today in your capacity interacting with the policy discussions?
Well, Dr. Smith, as he presented his information on the trends in Medicaid, reinforces the need for health plans and state government leaders to work closely together.
Oh, yeah.
Because even in spite of children and moms being in a more of a Medicaid managed care environment, the more costly and challenging populations are the duals and the age-blind disabled population. And those members are not in managed care. And so we need to sort out policies that align managed care plans and taking care of those very chronically ill members.
Mm-hmm. No question. I was mentioning earlier, I was at a conference of CFOs, I guess about 2 months ago, and controlling dual eligible expenses was like the number one topic on everybody's mind, and I don't know how we're going to accomplish it. Were there any? Has that presentation occurred yet? The one that you're presenting?
Just a little while ago.
Just a little while ago.
Yeah.
What were some of the key points that came out of that?
The speaker reinforced the fact that the trends are uncontestable from a cost standpoint. They're much faster expanding than the state's ability to fund those. And it's because many of those members are still in loose, fragmented fee-for-service systems that don't coordinate care.
Mm-hmm.
And the states that have taken on dual eligibles to work together between Medicare and Medicaid funding and managed care plans know that that can be done and be done with a high quality.
Mm-hmm. Now, how's WellPoint getting involved in that?
We support the interrelationship between the federal and state programs. We believe that the dual eligibles need to be in a managed care environment and want to make certain that it's done in a way consistent with our both Medicaid and Medicare best practices within WellPoint.
It's interesting. We had a conversation earlier this morning, someone who stopped by from Louisiana. And as you know, there have been big changes in Louisiana. And if I understood what she was saying, I don't think they were getting the dual eligibles involved in their new managed care plan. I have that wrong.
You may have it correct, but there are certain states that just have so much on their plate that they cannot take on another population to put into a managed care environment. And so, the federal government has released 15 states for pilots to do that. Mm-hmm. And the purpose of those pilots are to test best practices, make certain that the alignment between the clinical incentives and the outcome of care incentives makes sense. So the feds are approaching this, I think, from a very cautious but realistic standpoint that the integration must occur due to the finance pressures on the federal government and state budgets.
Do you think that the that kind of integration is going to proceed at its current pace, or do you think that within a little bit of time they're going to see some of the benefits of that and try to accelerate that?
One of the factors that I think drives a lot of the policy timelines is the fact of how the advocacy communities that represent the ageable and disabled populations align their interest and comfort with Medicaid managed care plans. Mm-hmm. And we know that the quality of care for Medicaid managed care members is higher than in a fee-for-service environment. And so I think some of the concerns about how the advocates feel that the members may be treated in a managed care environment will dissipate and therefore increase the adoption of managed care principles within the dual eligible population.
Mm-hmm. Do you think we're going to see any significant shifts in policy come November 23rd when the super committee makes its recommendations?
Boy, that's the big question. There's a lot of discussion in the halls here today with our colleagues across the country about what that means. But it's very clear that the super committee is studying the impact of unmanaged care for dual eligibles and making certain that they send the right signals to the industry about what must happen. So it's really going to be an exciting report that comes out.
It really is. I think it'll be even exciting if they get something done. Well, what do you hope companies will do with the information that was shared this morning?
Well, I can only speak for our company. We take back a lot of the presentation material, share it with our staff to make sure they're grounded in current Medicaid understanding of the business, make certain that our policies and practices are aligned to a future state. Because in this meeting, we get a lot of information both from state leaders and federal leaders about what they're thinking. And part of my job at WellPoint is to make sure that we're aligned with where the policies are going towards and making certain that our care systems, infrastructure, and frankly, our continued passion around the member continues in a very difficult fiscal environment.
Yeah, it really is. I mean, that seems to be the name of the game is, a lot of great ideas how we're going to pay for all this stuff.
Exactly, and that requires a lot of perseverance on our part to make sure that we can align the financial incentives with what state leaders want.
Yeah, no question. There are a lot of different Medicaid conferences that get involved with. Why do you pick this one to be involved with?
I'm new to the industry as of 4 years ago in terms of Medicaid managed care, and I found that both the quality of the speakers and frankly the culture of the members that attend and just the alignment between government and what the industry is doing is really great. And so I've become a very active participant in MHPA to, one, help improve that from a national perspective, but also it's got great content that's very valuable and we can put our hands on.
What, as vice chair of MHPA, you're obviously involved in some of the strategic direction of the organization. Could you share a little bit with us about what that's going to look like over the next year?
We want to become a very strong voice and practical resource for government, both the federal and state government, local at the state level, where states need help, that we can be thought leaders, give experience about what's worked, what's not, but jointly develop policy and recommendations that will better serve the Medicaid members. Because we've seen firsthand in our company and other companies as well, there are members in Medicaid today that never thought in their wildest dreams their children would be served by a public program.
Yeah.
And so the respect that we bring to that decision, and also the comfort that we give people that they got coverage through Medicaid.
The political climate in Washington it just appears to be so polarized. I mean, I don't live here, don't work here, but just from the outside, it seems to be everything is just so polarized. How do you think we're going to be able to push through some of these reforms and innovations in that? Do you think it's going to be a political process, or do you think companies are just going to have to get started and hopefully the politicians come along?
I think the best advice for all of us is simply to go with what we know, meaning we work and discuss the experience that we have. We bring to policy leaders things that we know work. A company like ours has scale across the country, so we can bring different geographies, different markets, different political leadership. And we think that's the best formula to participate and actively show results from Medicaid managed care.
No question, no question. Well, are there any other presentations you're looking forward to?
Donna Shalila will be speaking.
Oh, yeah, that's going to be a good one.
Very excited to see her, and being from Wisconsin, she led our university for quite a while, so I'm anxious to see her and get her counsel.
I bet. We try to get her to be a part of our program, and unfortunately she wasn't coming in till tomorrow, so we weren't able to have her a part of it. But we're very glad you were able to join us today.
Well, thank you very much for having me.
Yeah, Kevin, great to meet you.
Thank you.
Yeah, that's Kevin Hagan, President of State-Sponsored Business at WellPoint, and also Vice Chair of Medicaid Health Plans of America. Thanks so much for being a part of our show, Kevin. So what's the main reason that you attend a business conference? That's a question we're asking, and we'd really like to get your input on that. There are a lot of options that business people have today, and even in the Medicaid realm, there are a lot of options that people have. And it'd be great to get your take on what do you get out of the conferences. We've heard from our different guests on the show, on presenters at the conference here, what they're involved with and what they're a part of. So we're glad to get your input as well. As I mentioned to you, we have an all-star guest list for you over the next hour and a half left in our show, and we're going to be joined by a lot of different thought leaders, a lot of different corporate leaders in the Medicaid industry, and we think that this is one of the best lineups that we've had in a long time on our program. Is certainly this conference is certainly the epicenter of managed Medicaid, and we're glad that you're joining us for the next hour and a half. With me now is Cindy Helling. Cindy is the Executive Director of Select Health of South Carolina. She's also moderator of one of the presentations today, Risk Adjustment and Management. Cindy, thanks for being here, and welcome to Medicaid Matters.
Thank you.
Now, you're Executive Director of Select Health in South Carolina. What are some of the priorities in South Carolina today for Medicaid?
Well, South Carolina continues to be a high unemployment state with diminished revenues, so certainly quality and cost effectiveness are really important to legislators, the agencies, and to the companies doing business there. We're doing a lot of work to ensure that recipients who continue to qualify for Medicaid don't fall off the rolls. We're improving HEDIS scores, working to, as Director Keck says, to pay for health, not for health care.
That's like the way he phrased that. You know, that seems like that gets lost today in the discussions.
It does. That was kind of a new way to look at the healthcare delivery system. A lot of discussion and group meetings to figure out exactly what that means and how you put that into play.
You know, one of the things that I was, there were a lot of good things that came in healthcare reform when that legislation was passed. One of the things that I was a bit disappointed about was that it didn't seem to address the quality of care as much as it did the financing of health insurance and things like that. So it's refreshing to hear someone on the state level like that talk about, you know, we got to remember what we're focused on, and that is health, the health of this population. And it's easy to get lost in the business side of that, isn't it?
It is. One of the initiatives that Director Keck has brought to the state is to reduce elective C-sections and inductions prior to 39 weeks in pregnant women. And the state has gathered together hospitals, neonatologists, OBs, and managed care entities, and everyone has signed a pledge stating that there will be no elective C-sections and no inductions prior to 39 weeks that are not medically necessary.
Wow.
So there are champions identified at each hospital system and within the managed care entities to make sure that this actually happens. And the goal is to achieve a 10% reduction in NICU days and a 2% reduction in C-sections, which is huge when you consider how many pregnant women are on Medicaid every day.
Yeah, no question. And just the savings of a 10% reduction is just gigantic. I mean,
and that's a good intersection of cost and quality.
Yeah, no question about it. No question about it. Well, how is Select Health specifically addressing some of these priorities?
Well, we're participating on the Birth Outcomes Initiative. South Carolina has an annual assessment of cost effectiveness and quality, and the last year's report was just released, and it showed significant savings in the MCO program as compared to the medical home networks, and even steeper savings compared to the fee-for-service. But on the quality side, Select Health did very well. Managed care organizations as a whole had superior quality. So again, that was a good intersection of cost and quality. In addition to that, we have initiatives underway within Select Health to better improve our own members' health. One of the things we've touched off recently is an extreme teen fitness challenge, where hundreds of teens who are overweight are coming together in a program designed to help them lose weight and, more importantly, to become healthy.
And that in itself, if they can achieve that goal and become healthier, is going to have a huge impact on healthcare costs and savings.
Yes, both short-term and for the rest of your life.
Oh, yeah, no question. I think that gets lost again, I think, in a lot of the discussions about, how do we reform Medicaid or how do we improve the cost structure and so forth. I think oftentimes we don't go far back enough in the continuum of care to say, how do we help these people just not get sick anyway, or whatever it might be. And I think we lose sight of that sometimes.
And I think as Medicaid evolves, we will continue looking at the continuum of care. Right now, Medicaid is very focused on adults, pregnant women particularly, and children. And now there's more and more attention being paid to the dual eligibles. But it really needs to be that continuum from the moment the child is born up through the long-term care.
Yeah, no question, no question. Well, you've been here at the conference for a day, and what seems to be at the top of everybody's mind?
A lot of the same issues we're dealing with in South Carolina. The rising cost of health care as a percentage, both in federal and state spending, is huge. The super committee you were just talking with Kevin about, it's going to have a tremendous change in how we deliver health care in the United States. Directives that will come out of that group will have an impact on our healthcare system for many years to come.
Is Select Health doing anything specific to prepare for some of those things?
It's hard to prepare when you don't know what direction everything's going to go in.
Isn't that the truth?
We do discuss it, and we're developing strategies depending upon the direction that things go. I see this more as an iterative thing. It's hard to imagine that, December 1st, we will have a huge change in healthcare. It will take years to implement, and we intend to be a partner to that change.
Well, and for our listeners who may not be aware, November 23rd is when the super committee recommendations come out. The Senate has, I believe, or not Senate, but Congress has until December 23rd until they actually vote on it. Isn't that correct?
Yes.
Yeah. So, there may be a lot of recommendations, but I can almost bet whatever gets recommended is probably not what's going to end up getting voted on in total.
It's a very interesting time to be in Medicaid in the United States today.
We were talking with someone earlier, and I think there's a lot of innovation going on in Medicaid, they were saying, but there's also a lot of chaos right now.
Oh, I agree.
Yeah, no question about it. There are a lot of different Medicaid conferences that you could be involved with. It seems like every day or every week a different conference seems to pop up on the radar screen focusing on Medicaid. And I think that points to the, I can't remember if it was you or someone who said that in one of the presentations, one of the presenters said Medicaid is hot today. And I think that's one of the reasons why. But what is it about this particular meeting, this annual meeting at Medicaid Health Plans of America that brings you here and attracts you?
The theme for this year's meeting is the changing landscape for Medicaid health plans, which is huge right now.
Mm-hmm.
Medicaid landscape is changing around the country, and many states are facing the same issues, and certainly the federal issues, particularly around increasing enrollment and implementation of health care reform. So joining together with our peers to learn what's going on there, what's going on in the Medicaid health plan industry is extremely valuable. Mm-hmm. It allows us an opportunity to exchange ideas, best practices, and really just discuss what's going on throughout the country.
Mm-hmm. Yes, no question. It is an all-star lineup of guests and an all-star lineup of presenters at this conference. It's really anybody who is any kind of thought leader in the business of Medicaid managed care is probably here for the next 2 days. There's no question about it. You have now, have you been along in South Carolina? I forget. I didn't have a chance to look through your background. Have you been there for a long time in South Carolina?
I have, since 1995.
Okay. So South Carolina itself went through some changes over the last few years in Medicaid, didn't it?
There was a move from voluntary enrollment to they don't call it mandatory, but a new structure of Medicaid enrollment where recipients have been moved into managed care. Select Health has been there since 1995. We were the oldest Medicaid MCO in the state and the only one for many years.
Right.
With an advent of an enrollment broker, additional plans have joined. Some didn't make it and folded, and other new ones have come in to take their place. Select Health is now the largest at 225,000 recipients. But yes, there has been a lot of change, and we anticipate a lot more change to come.
I would think so. Especially with all that's going on in the industry. I mean, it's just, I think it's one of the issues that companies are struggling with right now is how do we keep up with everything that's changing? How do we stay on top of all of this and at the same time provide quality health care to our membership? So it's a tough thing to do. Any other particular presentations here you're looking forward to being attending today?
Well, I'm sure everyone tells you Donna Shaleva's presentation. But besides that, winning on the health insurance exchange, it's very interesting to see how the insurance exchange is playing out across all the states and really what will happen with federal legislation on that as well. So I have a lot of interest in listening to that one.
I would think so. In fact, I think we had the moderator of that particular session on here. How is South Carolina leaning in the?
Well, mostly they're leaning towards they would prefer not to have an exchange, but if they have to have one, they would like to have some control over it.
Sure.
So they're kind of in the middle right now. I think a lot of states are waiting to see what will happen with the exchange before they make definite plans on where to go.
Right. Well, makes sense. Well, thank you for joining us today.
Thank you. I appreciate it.
We hope maybe sometime in the future you can be a guest on one of our regular hour-long shows and talk a little bit more about what's going on in South Carolina.
I would enjoy that.
All right.
Thank you.
Cindy Helling, thank you very much. She is Executive Director of Select Health of South Carolina, and she's moderating a presentation here, Risk Adjustment and Management. Thank you, Cindy, for being a part of Medicaid Matters. Well, this conference, as you have already heard from the various people we've had on the show, is just an all-star list of Medicaid leaders, people who have had an opportunity to be a part of a program and who have really brought in with them people who or ideas and innovations that make a big difference in the lives of millions and millions of people. There's a lot on the agenda at the conference. I don't know if you've had an opportunity to look at what's going on, but really it's if you understand or know what type of topics are being covered and what part of the conference is going on, then you'll know that there's a lot of things happening. So it's really good to participate in these things and to be a part of the conference, and make sure you make plans next year to be in it. Well, we are joined now by Karen Clark. Karen is the president of Horizon New Jersey Health. She is also the chair of the Medicaid Health Plans of America Board of Directors. We had a great time this morning listening to her opening remarks and getting the conference started. So, Karen, welcome to Medicaid Matters.
Yes, hi. How are you? welcome.
I'm doing good. I'm glad you're here. Maybe you could, because of course, most of our listeners weren't able to attend your opening remarks this morning. Maybe you could touch on a few of the key points that you addressed.
Oh, yes. Well, first of all, I encourage your listeners to come down next year. It's a great conference. A lot
of
good information. And my main point this morning was to really set the tone for the conference. In short, I wanted people to understand that Medicaid is truly hot right now.
Mm-hmm.
And I made the point that the word hot used to be reserved for rock stars, but I'll tell you right now, Medicaid is truly hot. You can't open a newspaper, you can't turn on a news show without seeing something about Medicaid.
Isn't that the truth?
Absolutely. And that's because it is a large part of our spend right now in this country. It's actually moving toward 22% on average of state budgets.
That's amazing.
Yes, it
That's
is.
amazing. That's a lot of money, too.
Yeah, it's got everybody's attention,
Yeah.
especially our governors.
Yeah, no question about it.
Government.
They are really struggling right now in how to meet their obligations, aren't they?
Yes, they are. So when you're struggling to meet obligations and when you're facing, in some cases, deficits, you've got to look where the big spend is. And of course, as you know, Medicaid is countercyclical.
Mm-hmm.
So at this time where we're having economic issues, that's exactly the time people are losing jobs, revenue sources are down, and at exactly that time people need Medicaid to a larger number.
Yes.
So costs up, revenues down.
What would you hope the companies that were in your presentation and listening, what would you hope they would do with the information you shared?
Well, I'll tell you, it was kind of a call to action, and you've been around for the last day or so, and you've seen these CEOs of the health plans. They don't need a call to action. They're actually acting right now.
That's right.
But I wanted to make sure that over the next couple of days, they come together, plan to plan, competitor to competitor, that they also come together with many of the vendors who are here who are providing a lot of great services that will support our success in this healthcare industry. So I'm hopeful that over the course of these few days, people come together and talk about solutions. You hear about the challenges all the time, the budget deficits, all of the issues, the growth in the Medicaid spend, but what people need to hear now are the solutions. And I wanted to let people know that these CEOs of these plans that you see are people in many cases that have had 20, 30 years in this business, a lot of experience. They have plans that have the kind of infrastructure that's needed to really focus on the kind of patient-centered quality care that is needed to address our current healthcare problems. So I'm looking for a lot of solutions, best practices. In fact, Medicaid Health Plans of America is all about sharing those best practices nationwide.
They just had an award ceremony several months ago, didn't they?
Yeah, that's another good one. Were you there?
I wasn't there, but I remember Thomas Johnson was one of our first guests on this show, and we talked a little bit about that.
Yes. We'll be doing that again. So we actually have our compendium where you can read about our best practices. That's something that anybody can pick up from Medicaid Health Plans of America just simply by going on the website to order it or calling. But we do have that annual, it's actually a competition now, where people present their best practices and we choose 7 or 8 of them.
Yeah.
So
it's
a little
nice,
bit of fun, but
it
it's
really
also
is.
a wonderful opportunity to share solutions.
Really. Now, New Jersey has been through a lot over the last several months in Medicaid. Could you maybe share some of the impact that's had on Horizon?
Yes, a lot of people think of New Jersey as a small state, but I can tell you when it comes to health care, we really have been out there. So firstly, New Jersey has been in the Medicaid managed care arena for some time, and about 75% of persons on Medicaid for a number of years have been in managed Medicaid or coordinated care settings. But most recently, we took a major step in the state to begin to move away from fee-for-service Medicaid and to move populations that are generally not in Medicaid managed care into the 4 plans in New Jersey. So these are the frailest of frail, the sickest of sick, the age blind and disabled, the people with Medicaid and Medicare, people in these waiver programs that are being supported in their home, homebound people, and so forth. So we're caring for them and all the services that they need.
Right.
Yeah.
Right. And that's what, Medicaid's really all about, is the people who need it the most, but who are least equipped, either financially or just from a resourcefulness standpoint, to find the care that they need. And that often gets lost, I think, in a lot of the the discussions that go on about Medicaid is that, what are we really trying to accomplish here?
Absolutely. Yeah, we are trying to give, again, that patient-centered care that really improves outcomes for people. That's what we're ultimately about.
Mm-hmm.
And I'll tell you, people who are kind of outside of this industry actually look at some of these health plans as just another business. But you talk to some of these CEOs, and I think you have today, that are around, and very much mission-driven.
Oh, yes.
I know people walk into my organization and they talk to the nurses. We just hired another 100 people to care for the new populations.
Mm-hmm.
And most of them are nurses and doctors and social workers and others. And you talk to these folks, they're real mission-driven.
Mm-hmm.
Real mission-driven. It is about improving outcomes for some of our most vulnerable populations.
No question, no question. Well, we're going to need to go to a quick break here. And can you stay around for a few minutes? I want to talk a little bit more about what's going on at Medicaid Health Plans of America.
All right. To do that.
All right, so give us just a second here. We're going to go pause here before we start the second half of the show. The phone lines are open, 626-657-2125. And we're going to have more from our guests and hopefully some more from your comments when we get back. Again, that's 626-657-2125. We'll be right back.
You're listening to Medicaid Matters on the blogtalkradio.com network.
By providing access to the care they need and the quality they deserve, Medicaid Health Plans enhance health outcomes of our nation's underserved. Listen to this letter to a Medicaid health plan that helped save the life of Juan, a 4-year-old with a rare heart disease.
All of your efforts have created a miracle for my son. Even though he was so close to death, you helped. You made a difference. Now he's coming along, little by little, step by step.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at MHPA.org.
And welcome back to Medicaid Matters, live from the Medicaid Health Plans of America annual meeting. Hey, if you or your company are trying to get a message out to the Medicaid business community, this is the place to do it. Become a sponsor of Medicaid Matters, and each month reach more of the targeted Medicaid community. If you'd like to learn more about being a sponsor, you can email us at info@MedicaidTalk or call us at 615-257-1627. Medicaid Matters, make your voice heard. Mostly Medicaid spot.
Hi, this is Clay Ferris bringing you the Mostly Medicaid news headlines for the first 2 weeks of November 2011. The first headline: City to pay $70 million in Medicaid dues comes from the New York Times. New York City is going to pay the federal government $70 million to settle allegations that it improperly approved home care from the period of 2000 to 2008. Our next headline comes from McKnight.com. Bill reducing Medicaid eligibility passes House. The House passed H.R. 2576. What this bill is going to do is count Social Security income when determining eligibility for Medicaid and other federal subsidies starting in 2014. Our next headline comes from the Florida Times Union out of Jacksonville, Florida. Medicaid pilot program gets another extension. The controversial managed care pilot program in several counties in Florida is now given a 15-day temporary extension. The debate will continue about the billion-dollar-a-year low-income pool program as Florida continues to consider moving most of its Medicaid beneficiaries to managed care. Our next headline comes from the Los Angeles Times. California gets okay for large cuts to Medi-Cal. Medicaid providers in Medicaid are now facing 10% cuts in their reimbursement for Medicaid services. The Obama administration approved the cuts to California Medicaid provider benefits. Next headline, also from Los Angeles Times. 17 accused of Medicare fraud. A physician and a pharmacist and 15 others have finally gotten caught after years of bilking the Medicare program. program involved physicians writing prescriptions, runners running to pharmacies to get them filled, and then sending them back to other pharmacies for double payments on the drugs themselves. Our next headline comes from the Kansas Health Institute, KHI.org. Medicaid directors comment on proposed federal eligibility regulations. The National Association of Medicaid Directors is concerned about recent changes under the Affordable Care Act, also known as the Health Reform Act, that will allow expansion of the Medicaid rolls.
For more information about these news stories, as well as to check out analysis of Medicaid industry topics and job listings, visit us at mostlymedicaid.com.
And thanks to the people again at mostlymedicaid.com for giving us the headline update. You know, our show's popularity continues to grow thanks to you and the powerful guests we have with us throughout our show. People like Karen Clark, who's with us right now. Karen is president of Horizon New Jersey Health and also the chair of Medicaid Health Plan of America's Board of Directors. Karen, what are some of the goals for the association in 2012?
Well, for 2012, we've got a lot on our plate because there's a lot happening. So clearly, we want to continue strong partnership with the federal government and the state government, particularly around the planned health care reform. We're nearly out of time for that kind of planning, so we're working, of course, on the Medicaid expansion as well as the health care exchanges. We're very interested, again, in sharing best practices. We have a lot of member plans doing a lot of great things in healthcare. We want to actually spread some of that news. We're definitely interested in continuing to work with our states around expansion of populations to managed care where we think we can get better quality and improve costs. So particularly around the dual eligibles, those in Medicaid and Medicare, the age blind and disabled who have traditionally not been in managed care plans. So very much focused on those areas.
Sure. It sounds like a heavy agenda.
It is a heavy agenda, and that's just part of it.
Yeah, I can imagine. I can imagine. Well, I've had a chance to meet and get to know some of the leadership of MHPA, and I have no doubt that you'll get it done.
We plan to do that. I have no doubt as well.
Good. Now, I've asked this question of everyone. What are the other presentations today that you're looking forward to here at the conference? I know everyone says Donna Shalala, and I'm looking forward to that as well. Anything else that you think is a hot topic that you really want to sit in on?
Well, of course, all of them.
They're all hot first class. Yeah, there's no question.
But I'm particularly looking forward to a session tomorrow on special needs plans, and those are those plans that meet the unique needs of persons who are on Medicaid and Medicare. Obviously, they've spent down, or they're poor, and they're elderly, disabled, or blind. So there's going to be a special session on that. I think those are plans that have a lot of potential. There's some great people running those plans. I'm looking forward to that. There's also a session very much related. It's on connecting with people with complicated, complex healthcare needs. So I'm looking forward to what that'll be about.
Yeah, if we can get our arms around those, we'll save a lot, won't we?
Yes, we will.
No question.
And Donna Shalala.
Of course.
Of course. And I'll tell you, I don't know what the others' reasons were for wanting to hear her, but I'm very interested to see her perspective, because she was around, I don't want to age Donna, but some years ago looking at these healthcare issues.
That's
and
right.
She's been around the horn before. So I'm interested to hear what she has to say from that perspective.
Yeah, it's going to be very interesting.
Yes,
I'm sure of that. Well, Karen, thank you so much for stopping by. I know you're very busy today, and it's been a real pleasure having you on the show.
Thank you, and thank you for what you do here. It's really needed, and you're at the right time with this healthcare discussion.
Great. Thank you. Good. That's Karen Clark, president of Horizon New Jersey Health and chairperson of the MHPA Board of Directors. Thank you, Karen, for being a part of the show. As you can see, folks, Medicaid Matters. Its job is to bring the thought leaders to you. Its job is to bring the people on board who have the best knowledge, the best opportunity to give you the ideas and thoughts that are very important in today's discussion about what we're going to do to change Medicaid health care. And we're joined now by Michael Garner. Michael is the president and CEO of Florida Association of Health Plans. I know you just winged your way in this morning. Is that right?
That's absolutely correct. Just a couple hours ago.
He's going to be one of the presenters during a session called Louisiana's Path to Managed Medicaid.
Well, I think it's really a statewide focus.
Is it a statewide focus?
So we have Gil Dupree, who's from Louisiana, also from Louisiana Association of Health Plans, and myself. So we're going to be representing some of the statewide issues that we're going to see down on the ground type issues.
Sure.
So.
Well, there's no question Florida has been a leader in a lot of new and innovative things that have gone on in Medicaid. What do you think are going to be some of the points that the two of you are going to bring out in your session?
I think what we're going to really point out is that as we're trying to make sure that policymakers are aware of what managed Medicaid can bring to the table, that we're trying to make sure that they understand how we're different and how we bring a unique value proposition back to the table. And as part of that, we want to make sure that while we know policymakers often are focused on cost savings, that there's more important aspects, in particular quality, and patient satisfaction and direct patient care. So we want to make sure that we keep the focus going with policymakers around those important issues, so that on one hand, we do obviously want to make sure that we can bring solutions to the table for cost savings, but at the same time ensuring that patients are getting the right care at the right time at the right place.
Yes. We had a couple of weeks ago, we had a former state Medicaid director as a guest on one of our shows, and I was very impressed with his conversation about emphasizing the need for plans and states to be more innovative, more collaborative in how to not just deliver care, but improve the health of the Medicaid population. And I don't know if that's an anomaly in his state, but I know Florida has worked very hard in that direction. Do you find that that's going on across the country?
Absolutely. But there's going to be a greater and greater focus on quality as we move forward, not only for our individual health plans, but the best example I can give you is that the Florida legislature most recently, as they decided to move towards more managed Medicaid, is that they were looking at the historical resources they had at their disposal in order to try to help that population. And invariably, they ran up against those cost issues that ultimately meant that either you cut services, benefit eligibilities, or provider rates. And so and in doing all those things, we started worrying about access and we started worrying about quality. So in the legislation that was recently passed in Florida, expanding and transitioning people from fee-for-service over to managed Medicaid, in that process, quality in that particular bill, it was a 71-page bill, and quality was mentioned 38 times in that bill. And what we're talking about is not just quality in the sense of bean counting. We're talking about real clinical outcomes. What we're talking about is, are the patients getting better? It's not just a matter of are they seeing a number of visits, but are type 2 diabetics, are their hemoglobin A1Cs dropping? Are individuals with congestive heart failure getting the medications they need? Are we having Medicaid adherence that we need? Those types of care coordination systems that we ultimately bring into place that really ultimately will make a difference, not only again in the overall quality of life of individuals, but also ultimately reducing long-term healthcare costs down the road.
Yeah. There were several conversations that I personally was engaged with over the last 24 hours since I've been on site here, talking about healthcare data, and that there's a lot of healthcare data. In fact, we have an ocean of healthcare data, but we don't get a whole lot of information. And I'm seeing more RFPs across states for improved MMIS initiatives and so forth. Is Florida doing anything around improving that, or do you feel like you need to? You're in a pretty good spot.
Actually, we're actually moving very much in the sense of trying to improve those. Florida had moved actually a couple of years ago to a more encounter-based system, where not only were we trying to demonstrate what managed care plans we're actually providing, but also trying to take those measures and ultimately compare them against fee-for-service populations. And that's just now starting to happen, where ultimately we've never really been able in our fee-for-service area in Florida in particular, been able to say, what are we getting ultimately for our dollars? What are we seeing as far as access? What are we seeing as far as improved healthcare outcomes? For the first time now, with this new encounter data system that has been brought to bear on the state, we now have that data collected. We have millions upon millions of claims that have been submitted and encounter data that have been submitted by the managed care plans that are now actually being brought into an analytical situation because data is one thing, but if you don't have that data and use it to compare against something else, it doesn't give you much value. And so that's what the next step is, and that's where Florida's heading right now, and we're right in the midst of doing that. And I think that we're going to see some very impressive outcomes. Some preliminary research that I see, just for one very easy example, is emergency department utilization. We're always concerned about that. We know that's not the right way to get health care, and we know that there should be alternative settings, and in particular they need to go through primary care physicians and others to stay out of that most costly and really some of the poorer outcomes settings like emergency departments. So what we want to do is we're looking at those compared to what has happened in fee-for-service, trying to make sure that we're control for county size, and ultimately those preliminary data are showing again that managed Medicaid is bringing those particular utilizations down substantially and making sure that people are getting, again, the right care at the right time at the right place.
Yeah. There's always some natural resistance, it seems, from providers whenever you start talking about expanding managed care. At least I read about that quite a bit. How do you see health plans and providers being more collaborative to make this a reality?
I think that one of the biggest things is that the health plans, we've got to make sure that the providers are aware that our end goal really is the same as theirs, and that is their patients' outcomes. We want to make sure that we are coordinating along the practice plan that they've set up for that patient, that we're actually, if they're not aware of some of the better clinical outcomes, clinical evidence that they may be able to incorporate into their practice, that we have that opportunity to maybe identify that and work with them to make sure that they're aware of it. We know that providers are pressured more and more to spend, they want to spend as much time as they can with their patients, but at the same time they're challenged by just the fundamentals of running an operation. And so it's hard to keep up sometimes with those new clinical changes and best practices that are out there. Well, the managed care plan is a great opportunity to do so. So we believe that we can work together ultimately to bring that evidence back into the actual healthcare delivery system in a way that ultimately promotes better care for their patients, which are our members, and that's what we're concerned about.
Right. I think that's a great point, and I think the fact that if we're all driving toward the same outcome, which is to provide and improve the health care of a group of people in our states that need the help the most and are the least equipped to find it and get it, I think if we can all stay on that page, we're going to get a lot further down the road.
Absolutely.
No question about it. What do you hope companies do with the information that you're going to share in your presentation?
Improve. Just very simply, that no matter how good we are, we always can do better. And so my hope is that when we see that information, not only are we going to be definitively able to say this is how much better we are able to provide this than a fee-for-service environment, but ultimately we can take that as a learning experience back to within our own companies to say, how can we do better? How can we continue to improve? And a lot of times we sit there and I don't think any of us ever want to rest on our laurels, and we're always looking on how to do better. But that's exactly the one thing that I'm hoping that we can. In fact, my association has actually formed a quality improvement work group right now that is actually meeting this week with the express purpose of trying to say, how can we identify ways to ensure that we are really doing best practices around the delivery of quality healthcare moving forward.
Great. How does the experience in Florida, the managed care experience in Florida, relate to what's going on in Louisiana?
Louisiana actually has a very interesting system set up, especially their hospital system and the way that it's organized. And again, Mr. Gillard Dupree, who's going to be on that panel with me, can actually better represent that, where Florida has a much more diverse network of hospitals that are, while we have what are called statutory teaching hospitals, which are a lot of public, usually college-based, university-based teaching facilities, we also have a number of private, we also have a number of independent small hospitals in rural settings, and how those ultimately get coordinated and work together, I think, is substantially different than within Louisiana. We also have a longer experience, I believe, actually having managed care in Florida. The actual first HMO was in the early 80s, actually, within Florida, and at this current time, there's approximately 3 million people on Medicaid in Florida, of which over 1 million are currently enrolled in our healthcare plan. So we're very excited about the prospects of moving forward, and we think that Florida, with a new law that's been passed that will incorporate even more people into that and move away from fee-for-service over the next 2 years, we're very encouraged about the opportunity to provide that care for Floridians moving forward. Again, Mr. Dupree would have to give you some more
Sure.
examples about differences between Louisiana. So.
Sure. What would you say is at the top of the minds of most state health plan association directors right now?
State Health Plan Association directors right now are just wanting to make sure that we're providing a way and a forum for our health plans to speak to each other, to ensure that, again, we are doing the best to ensure compliance with the state, to make sure that we're providing the best patient care, that we're also sitting there always trying to identify new alternatives that we can bring to the table for policymakers. And I think if we focus on those areas, I think that we ultimately, as an association, have a great opportunity to provide service, again, to our patients, first and foremost, to policymakers second, and to generally to our actual health plan individuals within our health plan. So I think that those are some of the things that we would like to do as an association moving forward.
Great. Well, Michael, I appreciate you taking a few minutes. I know you got a lot on your plate today to stop by and talk with us. Maybe we can have you on sometime on our regular bi-weekly hour show and talk a little bit more about some of the things you brought up.
It would be my pleasure.
All right, great.
Thank you very
Michael,
much.
thanks for coming. Appreciate it. That's Michael Gardner. He's president and CEO of Florida Association of Health Plans, and he's going to be part of the presentation today, Louisiana's path to manage Medicaid. So we appreciate Michael being a part of the show. How you doing? Have a seat. In a minute, we're going to be talking with more of our all-star panel of guests today. You don't want to miss any of these folks. And right now, we have Mr. Dan Rizzo with us. Hello, how are you doing?
Doing well, how are you?
Good. Dan is Chief Innovation Officer. That is a nice title.
I worked for it.
Yeah, that's great. At MedAssurance. And his company is doing a presentation today, Mining a New Data Resource, which was a collaborative, was it a study or...
Yeah, indeed. We have a nice relationship with MHPA.
Right.
Our missions are very aligned and work to help advance the policy agenda. So today we are presenting the results of our first 2 studies.
Okay, great. Great. Well, I believe it's Katie Benjamin of your organization who's actually giving that presentation. What are some of the main points that are going to be part of her presentation?
Sure. She was looking to first orient the group to the relationship that MedAssurance has with the MHPA, helping to advance the policy agenda, helping to understand how data can guide us to understanding and improving the care that this important population receives, the Medicaid population. So our first studies were around looking at the MedAssurance More Squared Registry, a de-identified set of administrative and clinical data for about 77 million patients, a large number of those Medicaid patients, to understand how they're using care and how we can focus on issues that affect the daily lives of that population. The second study, which was really the highlight of her presentation today, was around outcomes of pregnancies of the Medicaid population.
Right.
About 40% of pregnancies in the U.S. are covered in some form or fashion by Medicaid, and so it's a tremendously important area, and she was highlighting some of the results of that outcome study.
40% of pregnancies in this country are covered under Medicaid.
Indeed.
I didn't know that.
Not only our data shows that, but Kaiser Family Foundation also presented data as such.
My goodness, I had no idea that. I knew it was a high percentage, but not 40%.
Yeah, and the outcomes around that differ dramatically from a commercially insured population. So looking at those outcomes and determining how can we focus on the right issues to get the appropriate prenatal care and postpartum care for that patient base so that our patient outcomes are better, so that our infant mortality is better, and so that those patients can be better off in those communities.
Yeah, I know it was very complex, but could you give us maybe just a broad outline of how this study was actually conducted?
Sure. This was a retrospective study using our More Squared registry again. About, in this case, 40 million Medicaid patients were examined across multiple years, 2006 through 2010. And in this study, we looked at the administrative claims data of a variety of health plans. MedAssurance works with about 200 healthcare organizations around the country, and in that have built a de-identified research database database. Using that research database, we looked for those indications of pregnancies, the markers that tell us here's when deliveries happened, here's the outcomes of those pregnancies, and through that administrative data, we're able to really look at variations in practice patterns across geographies, across age bands, and across the different types of insured populations within the Medicaid realm. So largely retrospective, but very informative about areas in how patients utilize care and where those utilization patterns drive outcomes.
How difficult was it to get a hold of that data?
That data has actually been accumulated over years by MediSurant working with our Medicaid Health Plan customers. And so in forming those relationships, we work with those customers to utilize the data in a de-identified fashion. So our great relationships with our Medicaid customers, and many of those are MHPA members, really drives our ability to do those type of studies.
Sure, no question. Well, it's interesting. We had several conversations here, and not just in the last hour and a half that we've been on the air, but in people that have stopped by and talked to us this morning about how there just seems to be an ocean of healthcare data, but not a whole lot of information.
Indeed, right.
And
you've heard the phrase, oceans of information, oceans of water, but not a drop to drink, right? It's how do you make sense of it?
Right.
And that is not an easy thing to do, particularly data of the magnitude we're working with.
But I'm guessing MediSurant would help a company do that.
Well, indeed, and we've built that expertise over many years. We're the industry leader in HEDIS outcomes reporting for NCQA accredited health plans and those who report HEDIS. We have built a tool set that allows that data to be mined and analyzed in a very easy fashion and a very rapid fashion. Some proprietary tool sets. So it is something that we really take pride in. How do we really take that ocean of information and distill it down to what's meaningful to the questions that are being asked?
Is there anything new coming from MediSurant that you think that's pretty exciting and interesting for our listeners?
I think we have really seen, particularly after the healthcare reform changes, that clinical and quality outcomes are more important today than they ever have been in the past. It's always been an important staple of the improving quality and managing care, but now it's turning itself around and driving financial improvement, and all of our clients are really focused on the responsibility that has been given to them by their underlying payers, the Medicare or Medicaid states, who need those managed care entities to drive improvements, and they're putting money behind it. We saw just recently the state of Ohio as an example, incentivizing through bonus payments for improving quality in 6 particular domains of care, and I think that trend in both Medicare and Medicaid is really putting a fine point on the need to focus on this issue, and that's where we're really looking to help. I think we've taken an approach that really takes the data. It's very much in line with our tagline, if you will, turning data into insight and insight into action. We've over the years, lots of entities have tried to harness data, but it takes another step. It takes doing something with that data, and boots on the ground, making actions, talking to patients, interacting with providers to drive change.
Well, it's certainly on the minds, I think, of a lot of state Medicaid directors. We're seeing, in our organization, we monitor what RFPs are going out and so forth, and we're seeing a lot of MMIS RFPs that are being issued. So, and I'm hearing from more people that we just have to get a better handle on this data, and there's probably so many solutions that would be so helpful buried deep within that if you could just figure out a way to pull it out.
Indeed, and the push and pull of population-based analytics down to member-based individual gap analytics. There's a place in the spectrum for all of those things. But how do you use them in a programmatic way to drive change? Whether you're a state Medicaid director and building your MMIS systems and your analytic systems around that, or you're a managed care entity, you need to be able to take that data and do something with it. And that's really where I think we're now seeing a big turn in the industry.
Right. It's this is probably a subject that we could do a whole hour-long show about if you're ever interested in doing something like that.
We could, and I would love to. We and perhaps some of the experts at the company who are living this day to day and seeing the effects in patients' lives of the types of actions that we're taking.
Sure, no question. This is something that I know is on the minds of all of our listeners. Everybody's trying to get a better handle around it. So some of those insights, especially from the Chief Innovation Officer, would be very helpful.
Oh, absolutely.
What other presentations are you looking forward to here at the conference?
I love to hear just the forward thinking of those who are at a higher policy level down to those who are in the trenches every day, telling us ways that they're making change and making improvements in the lives of beneficiaries in a way that both improves quality of care and does it in a financially responsible way.
Yeah.
So I'm looking for those little bits anywhere I can, and
right.
I think that's what my role at the company is looking to do. How do I find those little nuggets that help me serve a new need that this organization, this industry has?
Yeah, no question. Well, it's I think the phrase that you use, the forward thinking, is kind of the signature characteristic of this particular conference, because there's a lot of really innovative things being talked about here.
Exactly.
I hope that our listeners next year at least get a chance to come and be a part of this. Well, thanks for stopping by.
Thank you.
We appreciate it very much. Yeah.
Great.
And hopefully we'll get in touch with you. Maybe we can set up a time and have you on a show and just talk about some of the things you're up doing and being involved with.
Oh, we'd look forward to that.
Okay,
Thank
great.
you.
Thanks, Dan. Appreciate it. That's Dan Rizzo. He's Chief Innovation Officer at MedAssurant. They just completed a series of studies, really, with MHPA, mining a new data resource. And as you heard, data and staying on top of it is very, very important to what we're doing. Well, we're going to go to our last break here in just a minute. And we're actually coming up on that. This is your last chance to give us your input, your last chance to ask a question or to make a comment. The number to call is 626-657-2125, and we'll be back in just a moment as we go to our last break here. So stay with us. I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
Every 19 seconds, a child will die because of a lack of clean water. It is estimated that more than 80% of childhood diseases and deaths in underdeveloped countries are a direct result of drinking contaminated water. During the course of this commercial, 3 children will die. You can help make a difference in the lives of these children. By supporting Healing Hands International, you will provide safe, clean drinking water to families and villages around the world. Since 2006, Healing Hands has drilled more than 400 water wells in countries like Haiti, Ethiopia, Zimbabwe, and Honduras. Through the help of people like you, we have been able to bring the gift of clean water to more than 1 million people. To learn more about Healing Hands International and what we are doing to help, visit www.hhi.org. With your help, we can continue this life-saving work and make a significant difference in the lives of children.
Hi, this is Richard Gaden, and I want to take a minute to tell you about Ring Central. For more than 5 years, I've used Ring Central as my primary phone service in all of my businesses. And I know why Ring Central has become the #1 cloud-based phone system. Now, you might say that your company has a phone system, so why would you need Ring Central? Well, does your company ever need to quickly establish a presence in a new market? Do you use remote staff on a temporary basis? Do you have a side business, or do you do project-based consulting? It keeps your mobile phone number confidential and gives you a very professional presence. It's also easy and inexpensive to add a second line at home. And it's all less than $25 a month. If you even think Ring Central could be a solution for you, then you need to check them out. Visit our sponsors page and click on their ad, and you'll get a 30-day free trial. You won't regret your decision. And welcome back to Medicaid Matters, the only live talk show about the business of Medicaid health care. If you've been waiting to be a part of the program, now is your time. We're in our last half hour of our special 2-hour edition here live from the Medicaid Health Plans of America annual meeting. The number to call is 626-657-2125. You can also tweet your question or a comment to @MedicaidTalk, and we'll get that on the air. Again, for our regular listeners, you know we normally have a chat line that's up and all open. We were not able to do that here at the remote location, so we won't be able to do that for you. And don't forget to vote in this month's poll on our homepage. We're asking the question, what will a super committee do with Medicaid? And we're going to give a new car to the person who gets it right. No, I'm just kidding. We're not really going to do that. But we'll talk about the results at the end of the month. And if you're just joining us, we are talking with presenters and conference attendees here at the Medicaid Health Plans of America annual meeting in our nation's capital. And we're talking about almost everything under the sun. And we are joined now with a very special guest, Frank Ciano, who is VP of Business Development with Coventry Healthcare. Frank is going to be moderating a session at the conference, Medicaid Health Plans in the States, A View from the Ground. Frank, welcome to Medicaid Matters.
Thank you. Glad to be here.
Well, tell us a little bit about the session that you're monitoring.
Well, really what we're trying to make sure that everybody understands is that when you see a Medicaid program, you see one Medicaid program. It differs from state to state to state. And we have two great presenters from the state of Louisiana and from the state of Florida who will really show how states differentiate their Medicaid programs.
Yes.
And we will continue to see that at least for the next 15 to 20 years.
It's so true that, if you know Medicaid in one state, then you know Medicaid in one state. It's so different. Yet there are a lot of common characteristics that I think people just take those with a broad brushstroke and say, well, Medicaid's one thing here, it's another thing there. I know Coventry, you're in a lot of different states. How do you support all those, an infrastructure that can support all that different pieces and parts that go on in each of the states?
Well, as you know, government services aren't even the same. So even though we are in Medicare and all of the Medicare regulations are the same and you do Medicare the same way in every state, when it comes to Medicaid, you have to have the IT structures, you have to have the various information pieces that states require and states need. I think we heard one of our presenters last evening at the board dinner who was saying that if you're not into quality and really understand what quality means, it's going to really hurt your revenue.
Oh, it is.
It was really great to hear that kind of a discussion, and more states, and this is where similarity comes into play. They're learning from each other, and they're recognizing that if they really want to move the health outcome of their beneficiaries, then they need to be putting in quality standards.
Mm-hmm. And that is probably one common characteristic that we're hearing as well across all states is quality, and that it just has to improve and be measured much more effectively than it ever has before. Are you finding that to be the case in Coventry's operations?
Definitely, and I think all of us face the same challenge. It's a very difficult population to manage, but one we all welcome. And fortunately or unfortunately, most of the members in most of the managed care plans across the country are basically pregnant women and children.
Mm-hmm.
And they tend to be a little bit more mobile.
Mm-hmm.
But when you have the opportunity to work with the dual eligible population or the ABD, they're really going to be more long-term care, more stationary, you know where they are, and can really affect change.
Mm-hmm.
And that's where the big money is in terms of state costs.
Right. We find that in our business when we're working with a company to complete community-based assessments or needs assessments across a lot wide population. Just getting a hold of where everybody is and staying on top of that is probably one of the most difficult things to do.
Yes, being difficult, but challenging though in a good way, because it really forces people to work in a more cooperative environment. No one person can do it alone. You've really got to look at the resources in the community. You almost have to be a sleuth.
Yes.
And or an ambassador to
right.
be able to negotiate and bring people together so that they can work for the common good, which is the Medicaid beneficiary.
A couple of weeks ago, we had a former state Medicaid director on our show who kind of talked about his perspective of Medicaid and working with health plans. It was probably one of our most listened to shows that we've ever had. So I know there's going to be a lot of interest in the presentation you're involved with, a view from the states, what's going on in states and so forth. What do you hope that companies, that people in that presentation will do with the information that's shared?
Really understand that Medicaid is coming into age, into prime. Medicaid, I think, although all of us have been working with it for years and have an interest and real commitment to it, I think everybody else is starting to see that it really is going to be where growth is going to be happening in terms of the insured, or moving the uninsured to the insured. As I said, two great presenters. One state just implementing their very first Medicaid managed care in Louisiana, 900,000 lives, and then you've got a state like Florida, who is really going through a transformation. The governor and the state legislature has said the entire state will go to mandated managed care, and all the reasons why: improve quality, curtail costs. I think everybody's going to start seeing that more and more. I think one of the other presenters today talked about how Medicaid managed care was in 36 states, so it's not going to be too far behind for the rest.
Right, I believe that, and that's something that I know. I was at a presentation 2 years ago that Thomas Johnson gave, and talking about the expansion of Medicaid then, even when the uncertainty about health care reform legislation was still cloudy and nobody really knew where it was going to go. I'm curious, has your organization thought about the impact, some of the recommendations that might come from the super committee, how you would react to those? Or
I think every one of us is preparing for what the new legislation is, knowing that that's going to change somewhat. And so you really got to be planning for the 100-degree level of the reform, and making sure that you're working towards that. Everybody's watching the super committee. I think to expect that there's going to be major changes coming out of that, we'll see what happens. It's nice to see them dialoguing and trying to compromise and work together the way the legislature has worked in the past. So everybody's hopeful. It gives time to implement whatever it is that they do.
That's true. Isn't that the case? It doesn't seem to happen often when you have the time to do it. I think there's a lot of question as to whether they'll even be able to reach a consensus on what to do next. So,
well, if you're a political junkie like I am, you kind of follow it and you see what they're going to do. And I think at some point they'll have to make some decisions, because it's coming up on year's end, the election's next year.
Right.
Lots of people who are going to be voting for people, and you hear a lot of people saying change is in the wind. We'll see.
Yeah, we'll see. We certainly will. Well, what other presentations here are you looking forward to?
Really looking forward to the future of Medicaid in terms of the various opinions about cost. What's it really going to cost the state? I don't know whether you've been watching any of it, but you'll hear some people who say that Medicaid is going to bankrupt, and Medicare the country. But when you really look at some of the finances to the future actuarially, you're going to have a big spike in 2014, but then things even off to where they were in the past. And again, the quality pieces are really important, especially in business development. You're trying to make sure that you're understanding what all of the experts are talking about. The one unfortunate thing is that we've got our counterparts meeting across the river. The state Medicaid directors are meeting the exact time we are.
That's right, I saw that.
We're all together.
Yeah. Well, maybe that might be something we could do in the future.
That would be great.
It would be a very interesting conference for sure. As you have had a chance to talk with people here at the conference, you were here yesterday,
yes.
Correct, at the pre-conference, which was, the pre-conference agenda was a stellar agenda, not to mention just, what's going on here. But as you have talked with people, what seems to be on everybody's mind? Is there a buzz that you've picked up on about Medicaid?
Well, same thing that you talked about earlier. Everybody's concerned, wondering, trying to get opinions. What are people thinking in terms of the Medicaid reform? So I think that's kind of the general consensus. The other thing I think that's important is, even though there's a lot of people here who may be competitors in the insurers world, are coming together here and saying, okay, what do we really need to do, to try to work together and make that happen. So have to be careful, about some of that stuff, but at the same time, you can still be, when you look at the host of presenters, they're from every health plan.
That's right.
And everybody's got an interest, whether you're not-for-profit, for-profit, and or the regulators.
Right.
So,
yeah, I think I've noticed a lot more of a collaborative attitude and spirit at this conference than maybe 3 or 4 or 5 years ago. among competitors and so forth. I think it's a recognition that, we're all in this together. We're going to have to figure out a way to make it work across the board. And, it's good that the association has this compendium of best practices that everybody can access and use. Because at the end of the day, we're talking about improving the health care of people that need the most help. And I think being collaborative and working toward that goal is good for the organization. It's good for the industry.
And good for the country.
Yes, and good for the country.
Because a healthy young population will then be able to move on and go to school, get jobs, and
pay our Social Security, right?
That would be nice. Or Medicare.
Or Medicare, that's right. At least that much. That's right. Well, Frank, thanks for being with us today. Appreciate it very much. Maybe we can have you on at some point in the future on a full show and
Would
not
love
just for a
to do
few
that.
minutes. We'd really appreciate it if you could. Appreciate
you
you
very
being
much.
here. Yes,
Have a
thank
great
you.
day.
You too. Frank Ciano, VP of Business Development at Coventry Healthcare. He is moderating a session today, Medicaid Health Plans in the States, a view from the ground. So we're very appreciative of him taking the time and being a part of our program today. Hey, we're asking a question of all of our listeners, and we haven't, frankly, had a whole lot of input. What is the main reason that you attend a business conference? Now, every one of you probably do and go to a business conference, and you're part of it. And we'd like to know your thoughts about what are you trying to get and bring out of a conference when you come here. This conference, if you haven't already been, if you're not already aware of it, is a conference that is just packed full of information. This is the place to be if you are in managed Medicaid, in really any capacity. Just think about some of the things that are on the agenda here. Topics like best practices in integrated health management, best practices in pharmacy benefit management. And incidentally, in the future here, we're planning a show that will cover PBM in the Medicaid industry, and I think you'll want to be aware of that. Other topics: Medicaid modernization, audit and compliance issues are topics here. Best practices and clinical quality issues, health policy priorities and views. And that's all just today. That's not even some of the topics that were on the agenda yesterday in the pre-conference. That's not even some of the topics that were on the agenda for tomorrow. So a lot of high-quality information is shared at this conference. And as you have heard from our guests, I mean, these are the top thought leaders in the Medicaid industry. These are people who bring a perspective that you can't get anywhere else unless you're at a conference like this. So I hope that you'll make plans to be a part of the Medicaid Health Plans of America annual meeting next year. Again, it's going to be here at the Hyatt Regency on Capitol Hill. It's going to be at probably the same time of year and in the same location. So make plans to be here. There's a couple of things going on that you might want to be aware of. We've talked a lot about the Super Committee, and on November 23rd is when the Super Committee is going to have their release of information, or not really release of information, but they're going to talk about their recommendations. There's one of the things that we monitor, and I would encourage you to do as well, is Kaiser Health News. And there was an interesting article in here talking about the Super Committee being at an impasse. And we heard Thomas Johnson earlier this morning talk about perhaps an inability and a thought that the Super Committee just is not going to be able to reach a consensus with those things. It says that Washington's latest exercise in debt reduction appeared to be an impasse, and this is from last Thursday, as members of a special congressional committee barreled toward a Thanksgiving deadline with no movement on the fundamental question of whether to raise taxes. Now, that's going to be very important as we think about the next direction Medicaid health care is going to take and the issues of funding. We've heard that from multiple guests today, that funding is a big issue. And you know that as well. If you're in any way connected to Medicaid managed care, state budgets and funding has been topic number one for the last year and a half, and it's always been an important issue. As GOP Super Committee members huddled Thursday afternoon with House Speaker Boehner and Senate Majority Leader McConnell, GOP aides and lawmakers close to the process said they're still trying to horse trade with Democrats over revenue increases and cuts in entitlement programs such as Medicare and Medicaid. Now, we would actually need a crystal ball to have any sense of what those cuts are going to look like. And it's also important, I think, or interesting to note how much lobbying is going on to affect the outcome of the supercommittee recommendations. Interest groups are trying to really catch the debt committee's ear through this. Healthcare providers worried that Medicaid cuts and other programs have taken big ads around Washington to make their case. Lobbyists for defense contractors have been meeting with congressional staff members to warn of threats to national security if weapons programs are slashed. Farmers are anxious and are lobbying heavily to avoid cuts in crop subsidies. Cities and counties warn of rising crime rates if federal funding for police and fire services are curtailed. So everybody, and I mean everybody, is trying to have an impact on the supercommittee recommendations. And those recommendations are not going to be set in stone, of course. The final vote is going to be a month after those recommendations come out. But you'll want to pay very, very close attention to exactly what is going to be a part of those recommendations. And we're going to plan a show that's going to be right before, I think it's the day before those recommendations come out, that's going to address some of the issues involved in, or going to address some of the probable issues and the impact that those issues will have on policy and on Medicaid health care. We have 2 guests that will be part of that program, and we'll be announcing those very shortly. Certainly, if you want to get on the Medicaid Matters Blog Talk Radio show page, you can find out more information about that show. You want to make sure that you keep those sites bookmarked because they do change regularly. There are several ways to stay in touch with the show, and we're working on some new ways to help you stay in touch as well. But 2 places you want to stay bookmark and stay in touch with us is www.medicaidtalk.com. That's our main website where you'll get information about the show. That's where you can go to watch the show live if you're doing that. You can also go to our show page on the Blog Talk Radio Network, www.blogtalkradio.com/Medicaid Matters. There you'll find more details on our show schedule. You can access all of the archives that we have for all the shows that we have done. You can download them. You can find them also on your podcast. I think one of the things that's probably going to influence some of the supercommittee recommendations is how Americans feel about health care reform and the direction that they're taking. Now, most of you know our show originates in Nashville, and there was a very interesting study done by Paul Keckley, who is the the executive director of the Deloitte Center for Health Solutions in Washington. Paul is a Nashvillian and produced a committee which really was a study to see what Americans like and what they don't like about health reform. And there's no question that that type of information is going to influence some of the direction, at least in part, that the supercommittee takes. What Paul found was that, and really this was one of the first objective analysis, and they recently released these findings. The survey first attempted to create a baseline regarding how people feel about the current health care system. And the first question involved the public's perception of good value. We've talked about quality a lot today, and quality is something that can be measured, no question about it, but it's also something that is a perceived value. So the study looked at what does the public's perception of good value in healthcare services and products really look like. And respondents reported that they're finding good value. Americans say they see good value in 3 distinct areas. The first is physicians and medical specialists. Next was in pharmaceutical and prescription drugs. And finally in over-the-counter health products. Hospital care, as a good value, received a very slim majority. However, the product receiving the least perceived value was insurance premiums. And I don't think there's any surprise there. Regarding the performance of the overall healthcare system, the preponderance of Americans gave the U.S. healthcare system a bell curve C, and on a typical report card type of scale. Regarding particular attributes of the healthcare system, almost 2/3 of Americans favorably graded as A or B up-to-date technology, medical innovation, and state-of-the-art buildings. Receiving the least favorable grades of a D or an F were wait times and wellness services. Now, I'm sure that these perceptions are, can vary broadly from region to region, but I think for the purpose of managed Medicaid and Medicaid health plans, it's important to know that there's a lot of emphasis on perceived value, a lot of emphasis on quality, and that is something, as we have heard from a number of guests today, that is going to be going on and on and on as we progress toward the future and what's going to happen in Medicaid health care. Now, there was a flip side of this particular study, and it's something that I think is kind of interesting. On the flip side, the public, number one, did not view health reform as encouraging consumers to live healthier lives. And let me read that again. Healthcare reform is not something that encourages consumers to live healthier lives. Now, it was my impression when we first started down this path with healthcare reform that it was about encouraging people to live healthier lives, that it was about having people get a higher quality of health care. But this doesn't seem to be the perception, according to this study. Also, number two, the public did not view it as having a positive effect on economic recovery. In other words, economic recovery is going to be something that is really going to be harmed by the health care reform legislation. And third, the public expressed concern that health reform would increase paperwork in the healthcare industry. Interesting that the public would perceive an increase in paperwork when there's such a push towards EMR type of systems and trying to reduce the amount of paperwork and trying to make things more streamlined and more effective for people involved in that. So, in summary, according to the report, the public's view of healthcare reform had a big impact on health insurance, a modest impact on the delivery system, and little or no impact on creating healthier lives. In other words, people are saying that healthcare reform really just changed the insurance picture, really didn't do a whole lot on the impact of the way healthcare is delivered or how it's distributed across our country, and it had really no impact on creating healthier lives. And I think that's really the flip side of what we wanted to try to accomplish with healthcare reform. We wanted to have, really, I think, first, a greater impact on creating healthier lives. In other words, healthcare reform was improving the quality of people including the quality of people's lives, and not just the scope of their insurance program. That's a simplification of a very complex issue, I know, but it is, we're talking about perception, and that's the kind of perception that people seem to have. Now, along those lines, there's a lot of talk and a lot of information out there about repealing health law. And you're going to hear more and more about this as the presidential race gets tighter, as the primaries start. This is a drum being beat primarily by the GOP at this point in time. And there was a great piece in the Wall Street Journal a few days ago about how difficult it would be to actually repeal the health law. That might not be news to or music to the ears of those who are advocating it, but when you think about it, it would be very, very difficult to do, whether you agree with it or not. Some provisions of the law are linked with others, and you can't just take one piece of it and strip it out without having a tremendous impact on others, and really would cause problems for health insurers if they were dismantled. So that's one aspect that has to be handled. Polls also show a plurality of the public backs repeal, but people also favor very certain parts of the bill, primarily the parts that restrict insurers from declining or denying coverage for people who have pre-existing conditions. That's one very, very popular piece of the bill. In a March 2011 survey by the nonpartisan Kaiser Family Foundation, 74% they said they thought lawmakers should keep provisions that prohibited insurance companies from denying coverage because of a person's medical history. And when the health care overhaul passed in 2010, there's of course, a financial side of this. The CBO calculated it would reduce the deficit by $124 billion over 10 years. And since then, the Obama administration has shelved the law's long-term care insurance program, which the CBO originally estimated would save $70 billion over that time period. So there's a lot that the super committee is going to have to handle, a lot that's going to have to be done before we're able to get to the right piece and get the right thing done. Now, if you have not attended the MHPA's annual meeting, you can see that you're missing a lot. You need to be here next year. I would encourage you to make plans now. You can get all the details about it at their website, which is www.mhpa.org. We are very grateful that they invited us here to be a part of the conference experience, and you can learn more about them at their website and their events throughout the year at www.mhpa.org. Remember, our next show is going to be at regular day and time, Tuesday, November 22nd.
Seconds.
It's going to be at 1 p.m. Eastern, which is our regular time. As I mentioned, Clay Ferris is going to be our guest. Clay is the publisher of Mostly Medicaid. Clay and I will be trying to predict the outcome of the Super Committee recommendations for Medicaid. As you've seen, very, very few people here have said that that's something they wanted to do. We'd like to hear what you have to say on that as well. So why don't you make plans now to send us an email through our website, send us your thoughts about what you think is going to happen with the Super Committee, because it'd be great to share those on our next show. We've had an opportunity to hear from some of the top people in Medicaid healthcare today on today's show. I hope that you have found this to be interesting and enlightening. Again, you need to be here if you're involved in managed Medicaid healthcare by any stretch of the imagination. This is Medicaid Matters, and I'm your host, Richard Yaden. Today is today is Monday, November 7th, 2011, and we're going to meet here again online in the next 2 weeks. Thanks for listening. We're pleased you joined us.
Ten seconds. Thank you for using Blog Talk Radio. Goodbye.